students, after learning about the three components of the pharynx, that is nasopharynx, oropharynx and laryngopharynx, let us discuss about the structure of the pharynx. The wall of the pharynx is made up of 4 layers. These 4 layers, starting from the lumen to the outside, they are the mucosa, submucosa, muscular coat and outermost areolar coat. If you take the mucosa of the pharynx, then there are 3 components. It differs in the nasopharynx from that of the oropharynx and laryngopharynx. In the oropharynx and laryngopharynx, the mucosa consists of non-keratinized stratified squamous epithelium, whereas in the nasopharynx, it is the ciliated columnar epithelium, and the mucosa presents numerous mucosal glands. The mucous membrane of pharynx is continuous with that of the Eustachian tube, nasal cavities, mouth, larynx and esophagus. The submucosa is thickened in the upper part, starting from the base of skull to the upper border of the superior constrictor, and it is known as the Pharyngobasilar fascia. The muscle coat, it consists of outer circular and inner longitudinal layers. The outer circular muscles are constrictors of the pharynx, whereas the inner longitudinal muscles, they shorten the pharynx. The outermost areolar coat is known as the Buccopharyngeal fascia, and it is on the outer surface of the constrictor muscles, as the constrictors form the outer circular layer, and they also cover the outer surface of the buccinator muscle. At the upper border of the superior constrictor muscles, the Buccopharyngeal fascia blends with the Pharyngobasilar fascia. Now come to this picture. You can see the layers of the pharyngeal wall extending from the base of skull, and in relation with the auditory tube, you are seeing the layers in the pharyngeal wall, and towards the lumen is the mucosa. You can follow the mucosa. This is the innermost coat. Then you are seeing the Pharyngobasilar fascia, the green layer. So it's a thickened fascia in the upper part, starting from the base of skull to the upper border of the superior constrictor muscle. And then you can see the muscular layer consisting of the circular muscles, the superior, middle and inferior constrictors you are seeing. Now outside this constrictor muscles, you are seeing the Buccopharyngeal fascia, and which you can see is merging with the Pharyngobasilar fascia. You are seeing the merger of the two layers, the upper border of the superior constrictor muscle. And there is a space here that is known as the sinus of Morgagni, which we are going to learn in detail during the course of our discussion. Now let us see what is Buccopharyngeal fascia. It's a modification of deep fascia of neck. We can see in this picture the prevertebral fascia, one of the three layers of the deep fascia of neck, posteriorly in front of the vertebra you are seeing. And you can see the buccopharyngeal fascia running parallel to this. And you know that there is a carotid sheath which is formed in the neck. The buccopharyngeal fascia is parallel to the carotid sheath. And the other two layers of the deep cervical fascia are the general investing layer and the pretracheal layer. So you can see the anterior aspect, this is the general investing layer. This is the general investing layer. You can see it. And the other layer is the pretracheal layer in front of the trachea. So this pretracheal layer, it gives off this thin buccopharyngeal fascia along its medial aspect. And the buccopharyngeal fascia, as we have learned from the previous discussion, it closely invests the constrictor muscles of the pharynx. Coming to the extent of buccopharyngeal fascia, it extends from the superior constrictor muscle of the pharynx forwards onto the buccinator muscle. That's why it is called buccopharyngeal fascia. And it covers the outer aspect of the muscular layer of pharynx. And it is the epimysium on the outer aspect of muscles. This buccopharyngeal fascia is thinner than the Pharyngobasilar fascia. In this picture of mid-sagittal section of head and neck, you can identify the buccopharyngeal fascia. This green layer is the one extending from the base of skull down in front of the prevertebral fascia. This is the prevertebral fascia. And there is a space between the buccopharyngeal fascia and the prevertebral fascia, and that is known as the retropharyngeal space. In this picture, if you observe, this is the pharynx, and we can see the layers of the pharynx. Starting from the lumen, we have seen the layers, and on the outermost layer, that is the buccopharyngeal fascia. If you observe, it is connected to the prevertebral fascia in the midline, and it is fusing with the prevertebral fascia in the midline, and then it is separated from the prevertebral layer on either side, if you see, by a loose sheath, and that is known as the retropharyngeal space, which contains the retropharyngeal space. So the retropharyngeal space is the space between the prevertebral layer and buccopharyngeal fascia. In this sagittal view also you can see the buccopharyngeal fascia extending from the base of the skull, and you can see the constrictor muscles of the pharynx and the esophagus, continuation of the pharynx you are seeing. So the buccopharyngeal fascia is posterior to the esophagus here you are seeing, and it separates the esophagus from the prevertebral layer of fascia, and it is attached to prevertebral layer by a loose sheath between which is the retropharyngeal space. So it forms the anterior boundary for retropharyngeal space. In this picture of transverse section at the neck, we can identify the three layers of the deep cervical fascia. That is, you can see the outermost general investing layer, and then the pretracheal layer you can identify. This is the trachea and this is the esophagus, and you can see the carotid sheath containing the common carotid artery, the internal jugular vein and the vagus nerve. Then you can see the prevertebral layer of the fascia. Then behind the esophagus, we are seeing the buccopharyngeal fascia, and laterally it is blending with the carotid sheath. And if you trace it down into the thorax, it blends with the fibrous pericardium. Now let us see what is Pharyngobasilar fascia. It's the fibrous coat between the mucous membrane and pharyngeal muscles. So it is on the inner aspect of the muscular layer. So on the outer aspect of the muscular layer is the buccopharyngeal fascia, and on the inner aspect is the Pharyngobasilar fascia. And you can see in this picture the layers starting from the lumen, the mucosa you can see, and then the Pharyngobasilar fascia in relation with the submucosa. Then you can see the muscular layer, the constrictors of the pharynx, and the outermost buccopharyngeal fascia. And in this picture you can see the three constrictor muscles, and look at the Pharyngobasilar fascia. So it is the membrane that supports the mucosa, and above the level of superior constrictor it is thick, and it is attached to the base of the skull, that is the basilar part of occipital bone and apex of petrous temporal bone. It extends below into the pharynx. That's why it is called the Pharyngobasilar fascia. That is, it is extending from the base of the skull to the pharynx. Below the superior constrictors it is thin, and it forms the epimysium of the muscles on their inner aspect. Now in this picture we can see the constrictors of the pharynx. This is the superior, this is the middle and the inferior constrictors, and the upper border of the superior constrictor you are seeing, and above it you are seeing the Pharyngobasilar fascia extending to the base of skull, and the attachments of the Pharyngobasilar fascia. It is attached to the pharyngeal tubercle, which you can see in this picture. Then it is attached to the back of the foramen lacerum, Then the petrous temporal bone, it is attached in front of the carotid foramen. Then it is attached here to the cartilage of the auditory tube, the medial pterygoid plate and the pterygoid hamulus, and from there it goes to the opposite side. That is the attachment of the upper border of the Pharyngobasilar fascia. Whereas the lower border, it will be extending to the junction of the hard palate and soft palate, where you will find the Passavant's ridge. Try to recollect the Passavant's ridge, which we have discussed in relation with the pharynx. After learning about the Pharyngobasilar fascia and Buccopharyngeal fascia, let us see what is median pharyngeal raphe. The median pharyngeal raphe is a fibrous band that descends in the midline, starting from the pharyngeal tubercle of the occipital bone, which you can see in this picture. This is the pharyngeal tubercle of the occipital bone. From there you can see the midline raphe, which is descending on the posterior aspect of the pharynx. It is outside the pharyngeal muscles. So this fibrous band is forming the median pharyngeal raphe, and it gives attachment to the constrictors of the pharynx. You can see the superior, middle and inferior constrictors of the pharynx getting inserted into this median fibrous raphe. So it is running behind the fibrous layer, which is continuous below from the Pharyngobasilar fascia, and it is giving support to the Pharyngobasilar fascia. Coming to the muscular coat. The muscular coat of pharynx is arranged as outer circular and inner longitudinal layers with 3 muscles in each of these layers. The outer circular layer consists of the superior constrictor, middle constrictor and inferior constrictor muscles, which you are seeing in this picture. And the inner longitudinal layer consists of the stylopharyngeus muscle, the salpingopharyngeus muscle, the palatopharyngeus muscle. In this picture, what you are seeing is only the stylopharyngeus muscle between the superior constrictor and the middle constrictor on their inner aspect. Thus, this forms the inner longitudinal layer. Now, let us see the origin of the constrictors of the pharynx. The superior constrictor muscle of the pharynx takes origin from the pterygoid hamulus, the pterygomandibular raphe, the medial surface of the mandible at the posterior end of mylohyoid line, and on the side of posterior part of the tongue and the medial pterygoid plate. So it takes origin from this bones and the posterior part of tongue on its side. Coming to the origin of the middle constrictor, it is taking origin from the lower part of the stylohyoid ligament. This is the stylohyoid ligament. This is the hyoid bone. So from the lower part of the stylohyoid ligament, the lesser cornu of the hyoid bone and the upper border of the greater cornu of hyoid bone. The inferior constrictor muscle is in two parts. One is the thyropharyngeal part, the other is the cricopharyngeal part. The thyropharyngeal part takes origin from the oblique line of the thyroid cartilage. The tendinous band across the cricothyroid muscle. The tendinous band across the cricothyroid muscle and from the inferior cornu of thyroid cartilage. Whereas the cricopharyngeal part of inferior constrictor takes origin from the cricoid cartilage. And you know, all the constrictors, they get inserted into the median raphe and the posterior wall of pharynx. So anteriorly will be their origins and posteriorly will be their insertions. Now let us review the origin and insertion of the constrictors of the pharynx. So that forms the outer circular layer. So their origin is from the bones, ligaments or cartilages anteriorly, but they are getting inserted posteriorly. Their insertion is expanded and it extends from the pharyngeal tubercle to the pharyngoesophageal junction and along the median pharyngeal raphe. The superior constrictor is taking origin from the pterygoid humulus and posterior border of medial pterygoid plate. So that is the pterygopharyngeus part. Then the part taking origin from the pterygomandibular raphe is the buccopharyngeus part. The part taking origin from the mylohyoid line of mandible is the myopharyngeus part. And the part taking origin from the sides of tongue is the glossopharyngeus part. Coming to the middle constrictor. It's having a ceratopharyngeus part that takes origin from the greater cornu of hyoid bone and the chondropharyngeus part which takes origin from the lesser cornu of hyoid and lower part of stylohyoid ligament. The inferior constrictor is having two parts. It is the thyropharyngeus part and the cricopharyngeus part. The thyropharyngeus part is taking origin from the oblique line of thyroid cartilage and the tendinous band across the cricothyroid muscle. The cricopharyngeus part is taking origin from the anterior arch of cricoid cartilage. And these constrictors are inserted into the median pharyngeal raphe extending from the pharyngeal tubercle in relation to occipital bone to the pharyngoesophageal junction. In these pictures, you can see the both longitudinal muscles and the circular muscles of the pharynx. We can identify the constrictors. So the superior constrictor, the middle constrictor and the inferior constrictor, and above the superior constrictor, the longitudinal muscles which you are seeing are the salpingopharyngeus muscle, which is extending from the auditory tube, and the palatopharyngeus muscle from the soft palate you are seeing. Then you are seeing the stylopharyngeus muscle from the styloid process. So extending between the superior and middle constrictors. In this picture, you can see the superior constrictor, the middle constrictor and the inferior constrictor in the lateral view. From the posterior aspect of the pharynx also, you can see the 3 constrictors, and above the superior constrictor you can see the Pharyngobasilar fascia, and one longitudinal muscle which you can see in this picture is the stylopharyngeus muscle between the superior and middle constrictors. And if you see the inferior constrictor, it has got the 2 parts, the thyropharyngeus part and the cricopharyngeus parts. Coming to the actions of the circular muscles. The cricopharyngeus muscle, it has got the sphincteric action. It prevents passage of air into the esophagus. Whereas the thyropharyngeus part of inferior constrictor and the other 2 constrictors, they have a propulsive action. They push the balls of food down the pharynx. Coming to the inferior constrictor of the pharynx, there is a triangular gap between the thyropharyngeal part and the cricopharyngeal part, and this triangular gap is a weak area, and it is the weakest part of the pharynx, and this is known as the Killian's dehiscence. So this is the Killian's dehiscence between the obliquely running thyropharyngeus fibers which are supplied by the pharyngeal plexus and external laryngeal nerve, and the horizontally running fibers of the cricopharyngeus which is supplied by recurrent laryngeal nerve. So this is the Killian's dehiscence, and here you can see the inner circular and outer longitudinal fibers of esophagus. What is the clinical importance of this Killian's dehiscence? The mucosa of the pharynx can herniate through this weak spot, and this herniation is known as the Zenker's diverticulum, and this Killian's dehiscence is the site where perforations can occur during forceful esophagoscopy. So this is the gateway of tears. Now let us see what is Zenker's diverticulum. So it is a pharyngeal pouch. So the projection of the mucous membrane of the pharynx through the posterior weak part of the pharyngeal wall between the obliquely running thyropharyngeus and circularly or horizontally running cricopharyngeus muscles. that is the Killian's dehiscence. So it is a diverticulum of the pharyngeal mucosa just above the cricopharyngeus muscle, that is the Killian's dehiscence. So you can see this pseudo diverticulum of the pharyngeal mucosa above the cricopharyngeus muscle, that is through the Killian's dehiscence. How this Zenker's diverticulum is produced? Because of the pressure of food over the Killian's dehiscence, that leads to the formation of the Zenker's diverticulum. That's the reason for the formation of Zenker's diverticulum. It's the pressure of food over the Killian's dehiscence. And it will not involve all the layers of the esophageal wall. There will be neuromuscular incoordination. That is, there is incoordination of the action of cricopharyngeus and thyropharyngeus. So when the thyropharyngeus is contracting, the cricopharyngeus fails to relax. That makes the food bolus to be pushed backwards. That's the explanation for the formation of the Zenker's diverticulum. So the reason is neuromuscular incoordination. Here you are seeing the barium meal X-ray showing the expanded pharyngeal pouch, that is the Zenker's diverticulum. You can see in this picture. Here also you can see it. And you can see the vertebral column behind. So this Zenker's diverticulum cannot extend posteriorly because of the presence of vertebral column, and it will grow downwards and it will press on the esophagus, resulting in difficulty in swallowing, that is dysphagia. It can also trap part of food particles and that are going downwards. So it can result in regurgitation of wound food and aspiration pneumonitis can occur. So the diagnosis of Zenker's diverticulum is by barium meal X-ray. There are other diverticula also seen in relation to the pharynx. So they are seen in relation with the Killian's triangle, Limus triangle, Killian-Jamaison's triangle. The Killian's triangle is the region between the thyropharyngeus and cricopharyngeus muscles, which we have discussed as the Zenker's diverticulum. And the Limus triangle, it is the region between the cricopharyngeus muscle and the most superior part of the circular muscle of the esophagus. This is in the Limus triangle. Then the Killian-Jamaison's triangle. So the diverticulum is in the region between the oblique and transverse fibers of the cricopharyngeus muscle. Within that cricopharyngeus muscle, between its oblique and transverse fibers. After discussing about the circular muscle layers of the pharynx and their clinical importance, let us see the longitudinal muscle layer on the inner aspect of the circular muscle layer. The three longitudinal muscles are the stylopharyngeus, palatopharyngeus and salpingopharyngeus muscles. In this picture, you can see the salpingopharyngeus and the palatopharyngeus, the stylopharyngeus. The stylopharyngeus muscle, it takes origin from the styloid process and it gets inserted into the posterior lamina of the thyroid cartilage. The palatopharyngeus muscle, it takes origin from the side of the hard palate and palatine aponeurosis in relation with the soft palate, and it gets inserted into the posterior lamina of the thyroid cartilage and the wall of the pharynx. So that is the palatopharyngeus. You can see it getting inserted into the wall of the pharynx. Coming to the salpingopharyngeus muscle, it takes origin from the anterior end of the cartilage of auditory tube. From that, this is the auditory tube, and from the anterior end of its cartilage, it takes origin and it blends with the palatopharyngeus muscle. You can see it blending with the palatopharyngeus muscle. After discussing the musculature of the pharynx, that is the circular muscles, the constrictors and the longitudinal muscles, let us look into the structures that are passing between the constrictors, above the constrictors and below the constrictors. Between the base of skull and superior constrictor is the sinus of Morgagni, which we will discuss shortly. And in relation with that, you will see the tensor palati, levator palati muscles, the auditory tube, the ascending palatine artery and the palatine branch of ascending pharyngeal artery. Between the superior and middle constrictors are the stylopharyngeus muscle and the glossopharyngeal nerve. Between the middle constrictor and inferior constrictor are the internal laryngeal nerve and superior laryngeal vessels that pierce the thyrohyoid membrane. Below the inferior constrictor will be the recurrent laryngeal nerve and the inferior laryngeal vessels. So now let us see what is sinus of Morgagni. It is the space between the base of skull and the superior constrictor of the pharynx, and this is closed by the Buccopharyngeal membrane and Pharyngobasilar fascia. So the structures that will be passing through this space, that is the sinus of Morgagni, are the levator palatine muscle, the ascending pharyngeal artery, that is it, the palatine branch of ascending pharyngeal artery and the ascending palatine arteries. The tensor palatine muscle and the eustachian tube. So in this picture you can see the wall of the pharynx with the mucosa, the Pharyngobasilar fascia, the three constrictors you are seeing and the Buccopharyngeal fascia and the sinus of Morgagni between the base of skull and the superior constrictor and the eustachian tube that is passing through this membrane. So the sinus of Morgagni is a muscle deficiency area and its clinical importance is it's the potential route for the spread of the intracranial tumors to the parapharyngeal space. So that is the importance of sinus of Morgagni. After discussing about the three components of the pharynx in detail and the structure of the pharynx, let us look into the blood supply, lymphatic drainage and nerve supply of the pharynx. The arterial supply for the pharynx is from the external carotid artery and its branches. So the branches of the external carotid artery that are supplying the pharynx are the ascending pharyngeal artery, which is a branch of external carotid artery. Then the other branches that are supplying are the fascial artery through its ascending palatine and tonsillar branches it is supplying. The maxillary artery is supplying the pharynx through its descending palatine artery and the pharyngeal branches. The lingual artery supplies the pharynx through its dorsalis linguae artery. Coming to the venous drainage, the veins of pharynx drain into the pterygoid plexus, the facial and internal jugular veins. The lymphatics of pharynx drain into the deep cervical lymph nodes. Coming to the nerve supply of the pharynx, the motor supply is from the origin of nucleus is from the nucleus ambiguous and it passes through the cranial part of accessory via pharyngeal plexus. For the muscles of the pharynx, except stylopharyngeus, which is supplied by glossopharyngeal nerve. There is additional supply to the inferior constrictor from the recurrent laryngeal and external laryngeal nerves. Coming to the sensory innervation of the pharynx, the nasopharynx is from the pharyngeal branch that comes from the pterygopalatine ganglion in relation with the maxillary nerve. The oropharynx is supplied by the glossopharyngeal nerve. The sensory innervation for the laryngopharynx is by the internal laryngeal nerve. Coming to the formation of pharyngeal plexus, it is by the glossopharyngeal nerve, the sensory branch, then the vagus, the motor branch, and the cranial accessory that runs through the vagus. And it is the main motor supply of pharynx, including the soft palate. Then the sympathetic trunk contributes via the superior cervical ganglia. Coming to the clinical importance of pharyngeal tone, the tone of the pharyngeal muscles in sleep disorders. The pharyngoesophageal junction plays an important role. During waking time, the pharyngoesophageal junction is closed. Because of the tone of the cricopharyngeal sphincter, it is closed. While sleeping, this is dilated because the muscle tone decreases. So the pharyngoesophageal junction is dilated. During inspiration, there is negative pressure in the lumen of the pharyngeal airway. This negative pressure is contracted by the joint action of the dilators of the pharynx. That is the genioglossi, the tensor veli palatini muscles, the geniohyoids and stylohyoids. The conditions that reduce the pharyngeal tone are the sleep, alcohol, sedatives, hypothyroidism, and some neurological disorders that reduce the tone of these muscles. So the walls of the pharynx, they fall flaccid and get approximated. What will be the presenting symptoms? There will be intermittent pharyngeal obstruction that causes snoring. If the obstruction is continuous for longer periods, it can result in sleep apnea and other sleep disturbances. And what is the treatment for the condition? It requires surgical intervention known as the uvulopalato-pharyngoplasty. So it's a surgical rearrangement of tissues of the uvula, palate and pharynx in order to open up the upper airway to prevent the sleep apnea. So this is done by plicating the tonsillar pillars, reducing the bulk of soft palate, reducing the length of soft palate and tonsillectomy. So the importance of this pharyngeal muscular tone is in relation with the snoring, the sleep apnea and other sleep disturbances. With this, we have completed the discussion of the pharynx in detail.